All right, welcome. If you're a nursing student who's about to head into pediatrics, you're stepping into a field that is, well, both incredibly rewarding and really, really challenging. Today, we're going to dive into a topic that's more critical than ever before, pediatric mental health. So think of this as your foundational guide for assessment, recognition, and what to do next. Let's get into it.
I want to start with a number. Just one number that really sets the stage for everything else we're going to talk about. 1 in 5. Seriously, let that sink in for a second. Think about what that actually looks like in a classroom or on a playground or in the pediatric unit you're going to be working on.
That's right. 1 in 5 adolescents has a mental health disorder that could be diagnosed. So you have to ask, why is that number so high? Are we just getting better at diagnosing these things, or are the pressures of modern life playing a much bigger role? It's probably a little bit of both. But the bottom line is the same. More kids are in crisis, and way too many of them are slipping through the cracks. This isn't just a statistic. It's a huge call to action.
So to get a handle on this, here's how we're going to break it down. First, we'll try to understand the crisis itself. Then, we'll build out your nursing assessment toolkit. After that, we'll get into recognizing some common disorders, look at key interventions, and finally, we'll tie it all together to see why your role as a nurse is just so vital. Okay, first up, let's get a really clear picture of the landscape. Why are we even calling pediatric mental health a crisis? And what are the challenges you're going to face out there on the front lines?
Well, the whole system is under a massive amount of strain. For starters, we're just seeing a higher prevalence of neurodevelopmental disorders like ADHD and autism. At the same time, a lot of pediatricians, who are often that first point of contact, they just don't have the specialized mental health training. And, to make matters even worse, there's a severe shortage of child psychiatrists and therapists. This leads to these just enormously long waits for kids who need help now. And that is exactly the gap where a skilled, observant nurse becomes absolutely essential.
So, with all those challenges, how do you, as a nurse, even begin to help? Well, it all starts with your most powerful tool, assessment. Let's build out that toolkit. First, let's get on the same page with a clear definition. When we talk about mental illness, what we really mean are alterations in thinking, mood, or behavior that are serious enough to get in the way of a child's ability to function. This isn't just having a bad day. It's a persistent pattern that affects how a kid learns, plays, and basically thrives.
A really good nursing assessment is holistic. You have to look at the whole child, living in their whole world. What's their developmental level? How do social things like poverty or bullying play a role? Are there stressors at home? You've got to consider their culture, their key relationships with parents, friends, teachers. Are those relationships supportive, or are they a source of conflict? And all of this is layered on top of genetics and basic neurochemistry.
Okay, now that we have our assessment framework, let's move on to recognizing the signs and symptoms of some of the most common disorders you're likely to see.
So ADHD is definitely not a one-size-fits-all diagnosis. You have to recognize its two main presentations. First, you've got the inattentive type. This is the kid who might seem like they're always daydreaming, gets distracted super easily, or is constantly losing their homework. Then you have the hyperactive impulsive type, which is often a lot more obvious. That's the child who can't stop fidgeting, who runs or climbs when it's not appropriate, and who really struggles to wait their turn. And remember, a child can have one type or a combination of both.
This really drives home just how early the foundations for mental health are built. An attachment disorder can develop when that super basic fundamental cycle of a baby having a need and a caregiver responding to it gets broken. If that critical bond is disrupted, it can cause all sorts of later issues, like feeding disorders, failure to thrive, or even a full-blown attachment disorder, where a child just actively pulls away from caregivers.
Now, this is a really crucial point. Anxiety is the #1 pediatric psychiatric diagnosis, and it often brings its close cousin, depression, along for the ride. And here's the thing. In young kids who can't really tell you what they're feeling, anxiety often shows up physically. So you have to be on the lookout for those vague but persistent complaints. The constant headaches or stomach aches. This is exactly why a good assessment has to include direct questions about self-harm and suicidal thoughts. It's a question you just have to get comfortable asking.
Okay, let's clear up two disruptive behavior disorders that often get confused. On one hand, you have oppositional defiant disorder, or ODD. With ODD, you see this ongoing pattern of disobedience, arguing, and angry outbursts. But, and this is the key, the child usually feels bad about it afterwards. They feel remorse. Now compare that to conduct disorder, or CD. This involves much more serious violations of social norms. We're talking aggression, destroying property, even cruelty. And here is the single biggest difference. With CD, there's a profound lack of empathy or remorse. That is the dividing line you need to look for in your assessment.
All right, so we've talked about assessment and recognition. Now, what do you actually do? Let's build your action plan and talk about key interventions.
You know, care happens all across a spectrum. It can be something like seeing a school counselor, which is the least restrictive, all the way to an inpatient psych unit for a child who's in immediate danger to themselves or others. But across all of these different settings, the main goal is to create what's called a therapeutic milieu. Basically, a safe, structured, and predictable environment where healing can happen. And your role as a nurse is absolutely central to creating and maintaining that environment, every single shift.
And therapy is not just about talking, right? Especially with kids, it's so important to use approaches that meet them where they are developmentally. That means things like play therapy, art therapy, music therapy, and yeah, as you can see here, even pet therapy. Alongside these, you'll see proven approaches like cognitive behavioral therapy, or CBT, which helps kids reframe negative thinking. And of course, you'll be part of the team managing medications. Things like stimulants for ADHD or SSRIs for anxiety and depression are pretty common.
So what do you do in the middle of a crisis, like a full-blown panic attack? Here's your protocol. Step 1, and this is the most important, stay with the child. Your calm presence is a powerful therapeutic anchor. Step 2, decrease the stimuli. That means lowering the lights, reducing noise, and speaking in a really calm, quiet voice. And step 3, if it's been ordered, administer PRN, which just means as needed, anti-anxiety medication. It's simple, it's direct, and it's effective.
We have covered a lot of ground, so now let's bring it all home and talk about the single most important piece of this entire puzzle, you. Seriously, never ever underestimate your impact. In a system that's fragmented, with incredibly long waits for specialists, your sharp assessment skills can lead to early identification that can literally change a child's entire life. Your compassionate care is what creates that safe, therapeutic environment where a kid can even begin to heal. You are the constant presence. You are the advocate. You are the safe harbor.
So I'll leave you with this question. We've given you the framework, the key points to know. The real question is, what are you going to do with it? As you move forward in your career, how will you use this knowledge to be that nurse, the one who makes a profound difference for a child in distress?